Thank you, Mark. My name is Steve Laundrie. I will be conducting the rest of this program, covering the requirements for properly recording occupational injuries and illnesses, the specific forms that are required, and later on I will be going over some of the other requirements related to OSHA record keeping, posting, what to do if an OSHA inspector comes in, and employee access to the forms. So far, Mark has gone over some of the clerical issues related to OSHA record keeping. What types of businesses are covered, who counts as an employee. In this section, we will go over what makes a case recordable or not, and how to classify that case. Before we get started, I would like to take a little speaker's initiative. In the OSHA record keeping standard and in the interpretation letters, there are various references to a physician or licensed healthcare professional. I have a difficult time repeating over and over again in these presentations, physician or licensed healthcare professional. Also, OSHA has come up with an acronym for this, PLHCP, sometimes referred to as a plick-up, like a hiccup. I also find that very awkward, so I will not use that acronym throughout this presentation. I will be using instead the word provider. For OSHA, the use of the word provider will only apply to this presentation. It is not OSHA's definition, and it is not workers' comp's definition. Also, when we're talking about a licensed healthcare professional, we are talking about somebody who is specially qualified to diagnose and treat injured people, such as a nurse practitioner, a physician's assistant, a psychiatric therapist, psychotherapist, clinical psychiatrist, someone like that. They would all qualify as licensed healthcare professionals. Also, before we get into the issue of what makes a case OSHA recordable, I would like to point out in the OSHA standard 1904.35, which is a requirement by you as the employer to set up a way for your employees to report work-related injuries and illnesses promptly. Now, the standard does not go into details as to what is promptly, but ideally, promptly should be as soon as immediately after the incident as possible. We want to avoid a situation where an employee may tweak a shoulder and think it nothing, and then later on it becomes a case involving restricted work and or days away. Under 1904.35 also, you must tell each employee how to report work-related injuries and illnesses to you, whether it be directly through their supervisor or directly to you. Now, there is no set way of doing this. OSHA takes into account the fact that you may have a work environment where employees are out in the field, that they may have to contact you through cell phones or some other means of communication, or you may have language or literacy issues to deal with. For the next few slides, I will be referencing section 1904.4 of the OSHA record keeping standard. There is a flow chart that details the thought processes necessary for properly recording a new work-related injury or illness on your OSHA 300 log. The first question at the very top of that flow chart is, what did the employee experience an injury or illness? Now, it may seem obvious if there was an injury or illness. However, preventative measures such as days away, restricted transport, or prescriptions following an exposure are not recordable unless an injury or illness develops. Some possible exposures would include meningitis, whooping cough, and pertussis. This is a common problem that we see a lot in the healthcare industry specifically, where an employee may be exposed to a patient who has a case of whooping cough, and as a precautionary measure, the employee is kept away from work for 2 or 3 days. that in and of itself is not an illness, therefore it is not recordable. As can be seen on this slide, we have made a determination that there is no injury or illness, therefore it is not recordable. However, if there is an injury or illness, the next question that is asked is this case work-related? Ladies and gentlemen, I must give all of you a fair warning ahead of time. OSHA has an extremely broad definition of work relationship. So please fasten your seatbelts as we go over a detailed description of work relationship. The general definition of work-relatedness is detailed under 1904.5 of the Record Keeping Standard. A case is considered to be work-related if an event or exposure in the work environment either contributed to or caused the resulting condition or significantly aggravated a pre-existing condition. I ask all of you to please highlight those phrases contributed to, significantly aggravated, and pre-existing, especially contributed to. You could have an event occurring in the work environment that will have a very minor contribution to that injury or illness. OSHA would consider that case to be work-related. I will also go over details as to what is meant by significantly aggravating a pre-existing condition. Now, the second bullet on this slide indicates that work-relatedness is presumed for injuries and illnesses resulting from events or exposures occurring in the work environment. OSHA has a very broad definition of what is considered to be the work environment. They have defined the work environment as the establishment and other locations where one or more employees are working or present as a condition of employment. It includes not only the employee's immediate work area, but hallways, restrooms, stairwells, break rooms, the area immediately outside of the building, such as company-owned sidewalks.
Steve, what about parking lots?
We will discuss parking lots a little bit later. Suffice to say that the key to parking lot injuries is whether you have control over that parking lot. Continuing on this same slide, besides the physical locations around the building, OSHA considers the work environment to be a bubble around the worker themselves. So that also includes any equipment that the employee uses, such as tools, computer terminals. I had one situation where we had an employee go out into the woods with a clipboard and a tape measure. Those were considered the work environment. The next slide goes into the details as to what is meant by pre-existing conditions. Pre-existing means that an injury or an illness resulted solely from a non-work-related event or an event occurring outside of your employment. This event could have been something that occurred at your home, it could have occurred from a previous employer, or it could be an event occurring from a moonlighting type of employer. Either way, those types of events are considered to be pre-existing events. Now, if you had an injury while working for your previous injury while working for your current employer, that will be covered under 1904.6 under new cases. Also under 1904.5 is the term significant aggravation. A pre-existing case is significantly aggravated when an event and exposure in the work environment which would result in any of the following which otherwise would not have occurred: a death, a loss of consciousness, days away, days of job transfer, or restriction. Also, please note that I have highlighted an escalation in medical treatment. That means that an employee has a pre-existing condition, and due to an aggravation at the workplace, the treatment has been escalated or changed. An example of that would be a situation where you have an employee who works on a home computer at home. They're playing games or typing a letter or what have you, and they get a case of carpal tunnel at home, resulting in a wrist support. They come to work, continue typing, and it gets progressively worse. When that happens, the employee may get physical therapy or perhaps prescription medication. That is an example of an escalation in medical treatment.